Good morning, everyone. This is Dr. Alex Hernandez again from Life Chiropractic and Acupuncture. Today, I'm going to answer a very common question that I get asked here at the office, and the question is, which is better, an X-ray or an MRI? So I'm going to tell you what the difference are. There's advantages to one and disadvantages, but they're both really good diagnostic tools that we use. So let's kick it off with the X-ray. Here is an X-ray of a patient that came in. And this is basically the what we call the frontal view of the neck. So here we see the person's head, we see the teeth, and then we see the spine. And what I want you to pay attention to is one of the reasons that we take x-rays is to look at how your spine is out of alignment. So in this case, this gentleman was experiencing a lot of neck pain, and when we took the x-ray, the green line is the normal one, and the red line is how off the spine is. So this is very easy to see how out of alignment this person is and what's truly creating the neck pain. This is after we did some therapy, and then we can see the red line and the green line are almost pretty close. So we did a good job in here, and this is what allows us to do our job as chiropractors. What we want to do is align the spine, put it back to the center. So x-rays are really great. We get to see alignment. We also get to see if there's any kind of fractures. Really good at doing that. Now, what the x-ray does not show, we're not going to see what's going on with the discs. We're not going to see what's happening with the spinal cord. So that is the advantage of looking at the MRI. So let's have a look at the MRI. And this is looking at the neck from the side, just like this. And when we look at the MRI, here we can see the discs, here we could see the spinal cord, we could see the brainstem, the cerebellum. We could really see inside what's going on. We could see what's happening with the bones, if there's any kind of contusions. We could see if the discs are herniated, if they're touching the spinal cord. So this gives us a lot more insight as to what is creating your problem. This is another view. This is what I like to call the bird's eye view. And it gives us, again, one more dimension on how and what is happening with your spinal cord, what is happening with your discs. So the big question here is, when do you need what? When do you need an x-ray? When do you need an MRI? If we suspect that you have some kind of disc problem, we will send you out for an MRI. If we suspect something is happening with your spinal cord, we will send you out for an MRI. Now, if your problem is a bit simpler and we think that there's just misalignments, then an x-ray is appropriate for you. You won't need an MRI. So, any kind of questions, please call my office, 201-861-2025. Be glad to help you out.